Hello all, I am Dr. Madhavi, Consultant Palliative Medicine at Aster CMI Hospital. This video is about Geriatric Palliative Care. Now what is Geriatric Palliative Care? To know this, we have to learn about geriatrics. This is the specialty that deals with health problems in elderly, whereas palliative care does not have any specific age restrictions. It is an approach that could be appropriate for anybody with serious life-limiting illnesses. So, to collate both, geriatric palliative care is an upcoming niche specialty wherein we bring together both geriatrics and palliative care and form one comprehensive care plan for elderly people with severe life-limiting illnesses. Now why? What is the need for geriatric palliative care? As you all know, the quantum of aging population has increased exponentially in the last few years due to advancement in medical sciences. The proportion of aging population, which was about 7.5% in 2010, is expected to hit about 11.5% by 2025. The average remaining length of life at 60 years is expected to be about 18 years and plus. So during this phase, obviously the number of comorbidities like diabetes, hypertension, renal problems, liver issues, heart diseases adds on. With these multiple comorbidities, the number of visits to specialty clinics, the number of hospitalizations increases. This not only burns down the patients, but the family members and the caregivers who are taking care of them. In the recent world, the family dynamics has changed, wherein we come across both the partners who are in demanding profession. Due to this, it becomes very difficult for them to care for their parents, to find little time for them. And also, taking them to hospitals repeatedly might seem a tedious task for them. To overcome this problem, we, the Geriatric Palliative Care team at Aster CMI, have developed a multidisciplinary approach wherein we work in conjunction with your primary physician, be it your geriatrician or your specialty doctors like cardiologist, pulmonologist, nephrologist, neurologist, and make a one comprehensive treatment plan that is easy to follow, number one. Number two, it also reduces the number of visits to hospitals. We also believe in caring for the family members and the caretakers of our patients. In order to do this, we take the support of our clinical psychologists and provide enough emotional and psychological care for the family members and the caregivers. The main objective of the Geriatric Palliative Care team is to reduce the symptom burden in our elderly patients. Now, what is symptom burden? It could be pain, maybe knee pain because of osteoarthritis, maybe back pain because of degenerative disc problems, it could be peripheral neuropathy, it could be various kinds of cancer pains. One other common thing is nutritional deficiencies due to lack of appetite. They can have nausea, they can have constipation, they can have sleep disorders, memory issues. These issues impact on day-to-day life of our patients in a great way. In order to address to these issues, we, the Geriatric Palliative Care team at Aster CMI, have something called specialty clinics wherein we physicians, along with our physician assistants and nurses, train or rather teach the family members and caregivers various modalities to deal with these issues better. By doing this, the quality and dignity of our elderly patients improves to a great extent. One other major challenge of late is to make healthcare decisions for the elders who are seriously unwell, both at end of life and in anticipation thereof. We walk this journey with you by making advanced care plan discussions involving both the family members and the patients. By doing this, the patients get a feel that their values and preferences are well preserved. Their confidence levels boosts up. they start feeling that they are still capable of making their own decisions. On the other hand, for the family members, it is less anxiety and confusion during those later critical stages. The need of the hour, therefore, is to adopt a holistic approach and provide the elderly patients with best quality of life. In the end, to summarize, geriatric palliative care optimizes functional capabilities, reduces the symptom burden, and increases the quality and dignity of the elderly patients with serious life-limiting illnesses. Thank you.